now.
Go ahead, just start talking. And I'll show
All right,
you.
everybody, listen up. Hi. All right, so we're going to ask if you have any questions going through this, just send us nurses an email or stop in our office. We're going to try to keep this as short and sweet as possible. So we're going to show the film through here, and then we're going to ask that tomorrow you stop in your nurse's office for us to review with you EpiPens and a couple other things, since we can't do it all as a group. So if you can stop in tomorrow in your nurse's office, because the rest of the week I think it's optional if you're in the building. So if you can do that, we need to see you so that we can mark you off as finishing first aid, okay? Once we're finished with this, we'll have a list of who's all on here. We're going to try to get everybody. If we have people who are on here on cell phones, and you know that your screen name is coming, is the chat on? If your screen name is coming up as iPhone, you can look at your screen right now. You need to send Mr. Mazzocco an email that you were on and your screen name was iPhone. Otherwise, he won't know that you attended, okay? Somebody's on here, NC16101. You need to email Mr. Mazzocco and let him know who you are. And if you were in groups, if more than one of you is together doing this, so you're not all logging on because this is how we're taking attendance, you need to let Mr. Mazzocco know that you guys were in attendance. That needs to be done today so that we can get this over to Jameson by tomorrow. Anything else, ladies, that you can think of? To get your cards, Mr. Mazzocco will be sending you an email. You have to print your own card. You might remember this from the past, and then he'll give you instructions on what you need to do with that. Okay, so we're gonna simulcast the video right now, and hopefully this will go off without a hitch.
I got it. All right, video time, everyone. Let's see. Let's screen share this. First aid. I want to make sure that we start playing. I can hear it spinning. The answer is I don't know. I live my life. Nothing horrific. This DVD player is like
I figured we're probably going to use this as we do.
Oh, cute. I think Anthony made the one, but I'll put this one on my regular. Use it for your office. Well, I have it on my office, but I'll use this for my regular. I know. Bye. Thank you.
What will this one do?
That was skip.
Okay.
This is gonna be fast.
Okay, perfect.
I'm gonna go over there real quick. I'll be right back.
You're fine. Yeah.
All this time.
She can hear it all. Let me try this. All right, I'm sure you guys can probably maybe hear me. Angela, text me and let me know if you can hear me speaking to you right now. She can hear me talking? Mm-hmm. So why, how come I'm not hearing the video? They can hear me, you guys can hear me talking, but I don't understand why you can't, why you're having a hard time hearing the video when I have the speaker right next to the computer. And if I hit mute, because our background noise, you're not gonna be able to hear the speaker. So we're gonna try this one more time. We're gonna try to not move in this room and be really quiet. We're gonna give it another go around and see if we can get this. If you can hear me talking, we should be able to hear the video. And if anybody who hopped on late isn't muted, make sure you mute yourself because that could be cutting out the sound as well. I can't see that on here. Can you see if everyone's muted? If not, we'll try to get you all muted because that could definitely be cutting out the sound. All right, we're gonna try this again.
Or injured. And if you have questions regarding whether or not it's legal to provide someone first aid, all states have good Samaritan laws. These laws protect anyone who provides first aid. They put the person in the state, so be sure to check the law before you. When something like this happens, what do you do? In a matter of seconds, you need to act. But there are several things to consider as you start to provide first aid. First, make sure the scene is safe. You don't have any danger for you, the ill or injured person, or anyone else nearby. This is an important step. Do it every time you're providing help. Continue to assess the scene while you provide first aid and where anything that might change and make it unsafe. You can't help anyone if you're injured yourself. When you look around, ask yourself these questions. Is there danger for you or the ill or injured person? Is the injured person only exposed in danger, or can you tell them to safely provide first aid?
All right, for some reason you guys can hear me, but you can't hear the.
Is that everybody or just the?
No, everybody's telling me. I'm getting lots of messages. I mean, we have closed captioning on, so I just think that we're going to let this roll. I have absolutely no, Mike's not in here right now. I have no idea why you can't hear the speaker sound, but you can hear my voice speaking. I mean, I know I'm loud, but I wonder if the speaker's too loud. Maybe the speaker's too loud.
If so, have someone
So
from
we're
911.
simulcasting this
If no
video
one is near, phone for help.
through Zoom. It's just connected to the computer, but we have a speaker. Okay, so we lowered the volume on the speaker. Is that better? All right, time out. Mike's gonna work on something here.
Audio settings, system. Sound. Able to know control on scale.
As you assess the need for first aid, it's important to know one activate the network of responders. Exposed to poison. You will learn more about the signs and first aid options for these medical and injury emergencies later in the course.
Don't work.
There's a man down on the school lawn. I'm checking his phone.
They haven't heard any of this, right?
They said it works for a split second. They usually hear the music coming on, but then they don't hear the speaking.
What do we need to go back to? There we go.
Breathing normally, but unresponsive.
What's your address?
I'm at the Mitchell School, near the corners of Elm and Cherry Streets. 35 Cherry Street.
Okay, Mitchell School, near the corner of Elm and Cherry Streets. 35 Cherry Street. I've dispatched paramedics, so they're on the way. Is he on a flat surface?
Yes, he's on the lawn.
Does he have any injuries? Any medical information, jewelry on?
I'm checking.
Or, if you're with others during an emergency, then you would do as John and Janice did. They worked together. John started assessing the need for first aid while Janice phoned 911. When you're on the phone with the dispatcher, Don't hang up until the dispatcher tells you to. Answering all the dispatcher's questions won't delay the arrival of help. And be aware of your surroundings. Knowing the address of your location will help emergency responders reach you more quickly. It's also important for you to know how to phone for help from your location. Do you know how to activate the emergency response number in your workplace? For example, is it necessary to dial 9 for an outside line? Or is there an internal number to phone that will notify responders that are on site? For the purpose of this course, we will say phone 911 as the emergency response number. The video will now pause for you to write down the emergency response number for your location in your student workbook. As you assess the scene for safety, there are universal precautions you should take. These precautions are called universal because you should treat all blood and other body fluids as if they contain germs that can cause disease. Your first aid kit includes personal protective equipment, or PPE, such as eye protection and non-latex gloves. While you are giving first aid, these help keep you safe from blood and body fluids, such as saliva and urine. First aid kits may contain a mask for giving breaths in case you need to provide CPR. And because some people are allergic to latex or have developed sensitivity to latex that can cause serious reactions, you should use non-latex gloves if at all possible. You should always wear personal protective equipment whenever possible. However, if the person's blood does make contact with your skin or splashes in your eyes or mouth, take these steps. Remove your gloves if you are wearing them. Immediately wash your hands and rinse the contact area with soap and lots of water for 20 seconds. Rinse your eyes, your nose, or the inside of your mouth with plenty of water if body fluid splattered in any of these areas. And report to a healthcare provider as soon as possible. Because of the risk of infection, using protective gloves and taking them off correctly are important steps when it comes to your safety and the safety of others. Let's watch more closely how to remove protective gloves, and then you'll get a chance to practice. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so that it comes off inside out with the first glove inside it. If blood or blood-containing material is on the gloves, dispose of the gloves properly. Put them in a biohazard waste bag. If you do not have a biohazard waste bag, put the gloves in a plastic bag that can be sealed before you dispose of it. Always dispose of protective gloves properly so that anyone else who comes into contact with the waste bag does not get exposed to blood or body fluids. You should always wash your hands after removing gloves, just in case some blood or body fluids came in contact with your hands. To wash your hands properly, wet them with clean running water, warm if available, and apply soap. Rub your hands together and scrub all over for at least 20 seconds. Then, rinse your hands with lots of running water. Dry your hands using a paper towel or air dryer. If possible, use your paper towel to turn off the faucet. If you can't wash your hands right away, use waterless hand sanitizer. Rub your hands together so the sanitizer covers the tops and bottoms of both hands and all fingers. Then let the sanitizer air dry. Then as soon as you can, wash your hands with soap and water. Washing your hands well is one of the most important protections you have against infection. Now, as we go through the course today, you're going to have a chance to practice skills that would require you to wear gloves. Instead of actually using gloves for every practice, just say out loud, "I'm putting on gloves," as you begin. This way, you won't have to actually wear gloves every time. Watch. We've talked about assessing the scene to be sure it's safe and taking precautions such as wearing personal protective equipment. Next, you must assess the ill or injured person to find out what the problem is before you give first aid. Let's look at the steps more closely. First, make sure the scene is safe. As you approach, look for what could be causing the problem. Next, check to see if the person responds. Approach the person, tap him, and shout, "Are you okay? Are you okay?" If the person doesn't respond, and you are alone and have a cell phone, phone 911 and put your phone on speaker mode. Otherwise, send someone else to phone 911 and get the first aid kit and the AED. Check to see if the person is breathing. If the person isn't breathing normally or is only gasping, begin CPR. If the person is responsive, ask what the problem is. A person may only be able to move, moan, or groan when you tap him and shout. If so, phone or send someone to phone 911 and get the first aid kit and AED. If the person is breathing and doesn't need immediate first aid, look for any obvious signs of injury, such as bleeding, broken bones, burns, or bites. Finally, look for any medical information jewelry. This tells you if the person has a serious medical condition. Finding the problem is a skill you'll be tested on, so watch this demonstration, and afterwards, you'll get a chance to practice. First, make sure the scene is safe.
The scene is safe. I'm now putting on gloves.
Next, tap the ill or injured person's shoulder and shout to check for a response.
Sir, are you okay? Are you okay?
If the person does not respond, phone or send someone to phone 911 and get the first aid kit and AED.
Phone 911 and get a first aid kit and AED.
If you are alone and the person does not respond, phone 911 on your cell phone and put it on speaker mode to follow instructions from the dispatcher. Check to see if the ill or injured person is not breathing normally or is only gasping.
I'm checking his breathing. He's breathing normally. I'm checking for obvious signs of injury.
Look for any obvious signs of injury, such as bleeding, broken bones, burns, or bites. You'll learn about these soon.
I'm checking for medical information jewelry.
Also, look for any type of medical information jewelry. The video will now pause to let you practice finding the problem. In providing first aid, you might wonder, should you move an ill or injured person? Generally, no. This is especially important if you suspect that the person may have a pelvic or spine injury. However, there are times when the person should be moved. If the area is unsafe for you or the ill or injured person, move to a safe location. If you do need to move someone, here's one way to do it. Drag the person by his clothes. Place your hands on the person's shoulders, grab his clothes, and pull him to safety. And if a person is unresponsive in breathing, an option would be to roll the person onto his side. By rolling the person onto his side, you may help keep his airway open. As we wrap up first aid basics, it's important for you to know that you may learn private things about the person you are helping. Keep private information private. Share information about an ill or injured person only with emergency responders when they take over. In summary, you've learned the priorities, roles, and responsibilities of the first aid rescuer. Your role is to recognize that an emergency exists, make sure the scene is safe for you and the ill or injured person, phone 911, and provide care until someone with more advanced training arrives and takes over. You've learned the key steps in first aid, which include knowing where and when to get the first aid kit. Part of your first aid training is to know when to phone your emergency response number or 911. When you do so, you activate EMS, Emergency Medical Services, a network of emergency responders. Part of giving first aid is also taking precautions to protect you and the ill or injured person. You learned about wearing personal protective equipment and practiced the skill of removing protective gloves to protect you from blood and other body fluids. And you also learned and demonstrated the skill of finding the problem. Following the steps to find the problem helps you determine how to give first aid. For more information on the topics covered in First Aid Basics, refer to your student workbook. Next, we will take a look at medical emergencies. But first, the video will pause so that your instructor can ask you some review. In this part of the course, we look at the first aid actions for medical emergencies, including difficulty breathing, choking, heart attack, bleeding, and stroke. Your actions in the first few minutes when you see the signs of any of these conditions could help save a life. Breathing. It's usually smooth and easy. We run, play, go about our daily lives, and hardly even notice it. But if someone suddenly has trouble breathing, it's an emergency.
Let's go! Move up! Move up!
Antonio, pass!
Shoot! Nice! That's more like it! Josh, are you okay? Is it your asthma? Okay, where's your bag? Okay, hang on.
You can tell if someone is having trouble breathing if the person is breathing very fast or very slowly, is having trouble with every breath, has noisy breathing, you hear a sound or whistle as the air enters or leaves the lungs, or can only make sounds or speak no more than a few words at a time in between breaths, although the person is trying to say more.
Is this the right medicine? Here you go.
Someone with a medical condition, such as asthma, usually knows about his own medical condition. He often carries inhaler medicine, which can help him breathe easier within minutes of using it. At times, the person can have such a hard time breathing that he needs help using his inhaler. For this reason, you should be ready to assemble the inhaler and help him use it. To assemble an inhaler, first shake the medicine. Put the medicine canister into the mouthpiece, remove the cap from the mouthpiece, attach a spacer if there's one available and if you know how. To help someone use an inhaler, have him first tilt his head back slightly and breathe out slowly. Have him place the inhaler or spacer in his mouth and push down on the medicine canister, and then breathe in very deeply and slowly. Then have the person hold his breath for about 10 seconds, and then breathe out slowly. Also, it's important to know that there are different kinds of inhaler devices. To summarize, follow these steps for someone who is having breathing problems. First, make sure the scene is safe. Ask the person if he needs help. If he does, ask if he has medicine. If he has medicine, get it for him and then assemble and use the inhaler. Phone 911 if the person has no medicine, the person does not get better after using his medicine, the person's breathing gets worse, the person has trouble speaking, or the person becomes unresponsive. Provide CPR if the person becomes unresponsive and stops breathing or is only gasping. Stay with the person until someone with more advanced training takes over.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look.
If you look at page 2, there's a high-level view of the company. Actually, you know what? I think I have my own copy. Right here. Are you choking? Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away and try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around the person's waist so that your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrust instead of abdominal thrust. If you give someone thrust but cannot remove the object blocking the airway, the person will become unresponsive. Watch to see how this might happen and what you should do.
Sir, can you help me lower him to the ground? Phone 911 and get in the AED.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on a speaker mode so that you can talk to the dispatcher. Provide CPR if needed, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep as the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Your soccer team's doing great this year. You still enjoying it?
I like it and all, but I'm not as good as some of the other kids.
It takes practice just like anything else. Your mom and I were thinking about sending you to a soccer. Are you choking? I'll help you.
Choking in children is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the child can make sounds and cough loudly. In this case, stand by and let the child cough. If you're worried about the child's breathing, phone 911. If the block in the airway is severe, the child cannot breathe, talk, or make sounds. The child may also make the choking sign by holding his throat. If this happens, you need to act right away and try to clear the airway. When a child has severe choking, give thrusts slightly above the belly button. If the child is smaller, you may have to kneel to get into correct position. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. Act quickly by doing the following. Are you choking? I'm going to help you. Stand or kneel behind the child and place your arms around the child's waist. With one hand, locate the belly button. Then make a fist with the other hand and place the thumb side of your fist against the child's abdomen, just above the belly button and below the breastbone. Grasp your fist with your other hand and press your fist into the child's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object comes out and the child can speak, cough, or breathe, or becomes unresponsive. If the child is too large for you to wrap your arms around the waist and his choking is severe, put your arms under the child's armpit and your hands on the center of the child's chest. Pull straight back to give thrust on the chest instead of the abdomen. A child who has been given thrusts should see a healthcare provider as soon as possible. If you give a child thrusts, but cannot remove the object blocking the airway, the child will become unresponsive. Watch to see how this might happen and what you should do.
Help me lower him to the ground. Phone 911 and get an AED.
If a child with severe choking becomes unresponsive, lower the child to a firm, flat surface. Shout for help, phone or have someone else phone 911, and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, leave to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions, until the child starts to respond or until someone with advanced training arrives and takes over. Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrust to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up on a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out or the infant starts to respond, or until someone with advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. This concludes the section of our course on choking. To sum it up, you've learned the difference between mild and severe choking, how to help an adult, child, or infant with severe choking, and what to do if an adult, child, or infant becomes unresponsive when the choking is severe. It's important to act quickly because your actions can make a difference. Allergies are quite common, but if severe, an allergic reaction can quickly turn into a medical emergency. Symptoms of mild allergic reactions are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or signs of shock. An epinephrine auto-injector is a prescribed device that has medicine in it. The auto-injector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine auto-injector, he will generally know how and when to use it. You may help give the person the injection if you have been trained and your state allows it. In a moment, you're going to practice using a spring-activated epinephrine pen. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention, because you'll be demonstrating the same steps to your instructor afterward. First, make sure the scene is safe. Phone or send someone to phone 911 and get the first aid kit and the AED. To use the epinephrine pen, follow the instructions on the pen and make sure you are holding the pen correctly. Hold the pen in your fist without touching either end, because the needle comes out of one end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. Hold the pen in place for about 10 seconds. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pen to paramedics for proper disposal. If the person doesn't get better, or if there is a delay greater than 10 minutes for advanced help to arrive, consider giving a second dose, if available. Okay, now it's your turn to practice using an epinephrine pen. While the video is paused, you'll pair up with a partner.
So if we could just maintain the momentum we've had so far, looks like we can keep up our profits over the summer.
But why don't we add a new product line now when it's slow, and then we could increase production in the fall?
No, not such a good idea. If I could just try, tell you.
George, what's going on? You keep rubbing your chest.
Oh, I don't feel so good. Oh, it's no problem.
Listen, George, I'm trained in first aid. Can I help?
Yeah.
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and phone 911 right away, even if the person doesn't want you to. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. Also, many of the treatments for heart attack will be most successful if they are given quickly.
Yeah, I guess so.
Okay, tell me what's wrong.
It's just my chest feels tight. It feels like something is squeezing it. Oh, I'm starting to feel sick to my stomach. If I could just sit down for a minute, I'll be fine.
Alicia, phone 911. Tell them we have someone with tightness in their chest.
Got it.
And Joe, could you get the first aid kit and the AED? They're in the break room.
Yes, there's a man here. He's having tightness in the chest. He's sweating a lot and he's nauseated.
No, wait a minute. It's just some leftover heartburn. I just don't want to make a big deal.
Listen, George, do you have any allergies to aspirin?
No.
Have you had any bleeding lately? Have you ever had a stroke?
No, neither.
Yes, it's 8200 Bell Street.
George, I'm going to give you one adult dose aspirin. Chew that up and swallow it.
Okay.
We've just given him one adult dose aspirin.
Okay. Thanks.
Paramedics are on the way.
One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. But what about the difference between a heart attack and cardiac arrest? We often hear these two terms used as if they are the same, but they are not. Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing normally or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle normally nourished by that vessel begins to die. A heart attack can lead to cardiac arrest. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911, ask someone to get the first aid kit and an AED. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have the person chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive, be prepared to provide CPR. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Fainting may occur when someone stands without moving for a long time, especially if it's hot, has a heart condition, suddenly stands after squatting or bending down, or receives bad news. Fainting is a short period of time when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy and then becomes unresponsive. If you're asked to give first aid for a person who is dizzy but still responds, make sure the scene is safe. Help the person lie flat on the floor, and phone 911 if the person doesn't improve or becomes unresponsive. If a person faints and then starts to respond, ask the person to continue to lie flat on the floor until he can sit up and feels normal. If the person fell, look for injuries caused by the fall. Phone 911.
This don't make sense. What is going on here?
Sarah, is it your grades? Are you trying to get those done?
Remind me when these are due. What time is it?
Is something wrong? You don't seem like yourself.
Diabetes is a disease that affects the levels of sugar in the blood. Too much or too little sugar causes problems. Some people with diabetes take medication, such as insulin, to maintain their sugar levels. But if a person with diabetes experiences low blood sugar, her behavior can change.
I haven't had a chance to eat lunch, but I've got to get these grades done.
Sarah, you need to eat. You have diabetes, right?
Yeah, I know.
Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for her level of activity, or has injected too much insulin. If low blood sugar occurs in a person with diabetes, the person may become irritable or confused, hungry, thirsty, or weak, sleepy, or sweaty. Or the person might even have a seizure.
Trudy, can you get Sarah some orange juice? She needs something with sugar in it. Sarah, would you feel better lying down?
No, I'll be okay.
Can you eat something and swallow? Trudy's bringing you some juice.
Yeah, I can do that.
Signs of low blood sugar can come on quickly in someone with diabetes. Take the following first aid actions. If the person can sit up and swallow, ask her to eat or drink something with sugar that can rapidly restore blood glucose levels. These items include glucose tablets, orange juice, or soft chewy candy such as jelly beans. If the person can't sit up or swallow, don't force her. Have the person sit quietly or lie down. If the person does not improve within 15 minutes, phone or have someone phone 911. stroke is another medical emergency for which you may need to use your first aid skills. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST method to recognize the warning signs of stroke. It's a simple way to remember the warning signs of stroke, which are face drooping. Does one side of the face droop or is it numb? Arm weakness. Is one arm weak or numb? Speech difficulty. Is speech slurred? And time to phone 911 if someone shows any of these symptoms. If you see these signs and think someone is having a stroke, take these actions. First, make sure the scene is safe. Phone or have someone phone 911 and get the first aid kit and AED. Note the time when the stroke signs first appeared. Remain with the person until someone with more advanced training arrives and takes over. If the person becomes unresponsive and is not breathing normally or only gasping, provide CPR.
All right, right, left, and go. Again. Again, right, left. Right, left, a little faster. Right, left, again. Right, left.
Darla? Dottie? There's something wrong.
Darla, are you okay? She's having a seizure. I need everyone to stay back and please move these things away from her so she doesn't get hurt. Beth, I need you to phone 911, put it on speaker mode and leave the phone here next to me. I need you to go to my office, get the first aid kit. It's right on the wall right next to my desk.
Okay.
911, what's your emergency?
Yes, we have a woman down on the floor. We think she's having a seizure.
What's your address?
We are at the karate studio off 5th and Lamar. It's 5110 Lamar.
The karate studio at 5th and Lamar, 5110 Lamar. We're sending paramedics, so please stay on the line.
Okay, thank you.
Should we put something in her mouth for her to bite down on?
No, you do not want to put anything in a person's mouth when they're having a seizure. Darla, are you okay? Are you okay? Her seizure has stopped. She's moving and breathing, but she's still not responding. Darla, it's Dottie. I'm here to help you.
A seizure is abnormal electrical activity in the brain. Most seizures stop within a few minutes and are often caused by a medical condition called epilepsy. But they can also be caused by head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. During a seizure, a person may lose muscle control, fall to the ground, or stop responding. And the person usually has jerking movement of the arms, legs, and sometimes other parts of the body. However, not all seizures look like this. Some people might not respond and have a glassy-eyed stare. During the seizure, a person may bite her tongue, cheek, or mouth. You can give first aid for that injury after the seizure is over. And after a seizure, it isn't unusual for the person to be slow to respond, be confused, or even fall asleep. The most important first aid action for a person having a seizure is to protect the person from injury. Move furniture or other objects out of the way and place a small pad or towel under the person's head. Then phone 911 and get the first aid kit. After a seizure, quickly check to see if the person is responsive and breathing. If she is unresponsive and is not breathing normally or only gasping, provide CPR. Stay with the person until advanced help arrives. If the person is having trouble breathing because of vomiting or fluids in her mouth, roll the person onto her side. There are also some myths about what you should do to help someone who is having a seizure. Some of these can actually harm a person instead of helping. This video and your student workbook provide the correct information about caring for someone having a seizure.
Darla, it's Dottie. I'm here to help you.
What happened?
You had a seizure. We were in the middle of a lesson. We phoned 911 and the paramedics are on their way. Oh, my mouth hurts. I think I bit my lip. Here, let me get you something for that. Put this in between your lip and your gum and press down. That should stop the bleeding.
When a person has a mouth injury, it can be serious if blood or broken teeth block the airway and cause breathing problems. But bleeding from the mouth can usually be stopped with pressure. When giving first aid, make sure the scene is safe. Get the first aid kit and wear personal protective equipment. If bleeding is coming from the tongue, lip, or cheek and you can reach it easily, apply pressure with gauze or a clean cloth. If you haven't phoned 911, and if you can't stop the bleeding or if the person has trouble breathing, phone or ask someone else to phone 911. By now, you've learned how to describe the assessment and first aid actions for the following medical emergencies: breathing problems such as asthma, severe choking in an adult, child, or infant, severe allergic reaction, heart attack, fainting, diabetes, stroke, and seizure. You've also learned and demonstrated an important skill: how to use an epinephrine pen. Next, we will take a look at injury emergencies. But first, the video. In this part of the course, you'll learn about injury emergencies. This includes external and internal bleeding. Bleeding can quickly become life-threatening if not controlled. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a person can lose a lot of blood within minutes. Minor bleeding occurs from small cuts or scrapes. Most bleeding can be stopped with pressure. It's important to stay calm. Bleeding often looks worse than it is. Let's go to a scene where a store employee was cut by broken glass. Watch closely how another employee used her first aid training to stop the bleeding.
Ah! Lisa, I need your help.
Tom, are you all right?
I cut myself.
Sam, can you clean this up before someone else gets hurt? Let me see your arm. What happened?
I mean, I just grabbed the frame, tried to put it on the wall, and it just slipped from my hands.
All right, it's all right. Remember, I took that first aid course. Let's go over to this counter.
Okay.
I'm gonna get the first aid kit. Put this gauze on the cut and press down while I get my gloves on.
Okay. I would have never thought this would happen to me.
It's all right, things like this happen. All right, I'm gonna try to get the bleeding to stop, but I'm gonna have to press down hard, okay?
Okay.
Okay, it's bleeding through, so I'm gonna add some more gauze.
Can you take the old one off?
No, it might pull out some clots and make the bleeding worse. I'm gonna push down a little harder with this extra gauze, and I think we can get the bleeding to stop with a little more time and pressure.
Okay.
Okay, looks like the bleeding has stopped. Let's get a bandage on it.
Thanks.
Lisa is able to stop Tom's arm from bleeding with direct pressure and the use of dressings and bandaging. Let's talk about the difference between a dressing and a bandage so that you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a bandage. To stop external bleeding, take the following first aid actions. First, make sure the scene is safe for you and the injured person. Send someone to get the first aid kit. Put on personal protective equipment. If possible, have the person apply direct pressure. Apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area. Use the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding is stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. For minor cuts, wash the area with soap and water and then apply a dressing to the wound. Now, we'll show you a demonstration of the steps for stopping external bleeding. You'll practice what you learn afterward, so pay close attention. First, make sure the scene is safe for you and the injured person. If appropriate, have someone phone 911 and get the first aid kit and AED. Put a dressing on the wound. Apply direct pressure on the dressing. Use the flat part of your fingers or the palm of your hand. If the injured person is able to do so, ask him to hold gauze to the wound and apply pressure while you put on protective gloves. Then, let him know you will take over. If the bleeding does not stop, apply more dressings on top of the first and press harder. Keep pressure on the wound until it stops bleeding. Do not remove any gauze once it's in place. After you have used direct pressure and dressings to stop the bleeding, apply the bandage over the dressings to keep pressure on the injury, protect it, and secure the dressings. The video will now pause. You've just practiced the steps for controlling bleeding and bandaging. But what if the cut is much deeper, and after you've applied pressure and dressings, the bleeding doesn't stop? Let's go back to the store and see what happens if the situation were much worse. Tom has a much deeper cut, and applying direct pressure isn't enough to stop the bleeding.
Tom, are you all right?
I cut myself.
Sam, can you clean this up before someone else gets hurt?
Yeah, I got it.
Let me see your arm. What happened?
I grabbed the frame, tried to put it on the wall, and it just slipped from my hands.
It's all right. Remember, I took that first aid course. Come on, let's go over to the counter. That looks pretty deep. Here. Put this on it and press down hard while I'm calling 911.
911, what's your emergency?
It's my coworker. He cut his arm on some glass at the store and it looks pretty bad.
What's your address?
It's 6977 Rose Street, the antique store.
Okay, 6977 Rose Street, the antique store. I've dispatched paramedics. Is he conscious?
Yeah, he's conscious.
And where is he bleeding? Have you tried to stop it?
It's his arm, his left forearm. I'm trying to stop it now. I'm using some gauze and pressing down really hard, but it's not stopping.
Do you have a tourniquet?
Yes, there's one in the first aid kit.
Go ahead and use it and put it about 2 inches above the cut.
Apply pressure while I get the tourniquet. Okay, I'm gonna put this tourniquet on your arm to try to get the bleeding to stop, okay? Hang in there with me.
Okay. That's tight.
Yeah, but I think it's working.
I'll note the time is 2:30. Please write that on the tourniquet. I share the paramedics are almost there.
Sam, can you meet the paramedics outside and let them in? Thanks.
Lisa tried to stop the bleeding using direct pressure, but the cut was deeper than originally thought, and applying pressure didn't stop the bleeding. When this happens, use a tourniquet. The first aid kit should contain a pre-made or manufactured tourniquet. It includes a strap that you wrap around the injured person's arm or leg and a straight stick-like object called a windlass. The windlass is used to tighten the tourniquet. If applied correctly, a tourniquet should stop the bleeding. If you don't have a tourniquet, you can make one. Fold a cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a small hand tool, stick, or something similar. Turn the item to tighten the tourniquet. Continue tightening until the bleeding stops. Secure the hand tool or stick so the tourniquet stays tight. Note what time the tourniquet was placed. To summarize, take the following actions when using a tourniquet. The loss of a lot of blood can lead to shock. Besides loss of blood, shock can be caused by a heart attack or severe allergic reaction, among other things. At our store, if a tourniquet was not available, it could lead to a significant loss of blood, and the person could go into shock. A person in shock may feel weak, faint, or dizzy, feel nauseated or thirsty, have pale or grayish skin, be restless, agitated, or confused, or be cold and clammy to the touch. First aid actions for shock are: make sure the scene is safe. Phone 911 and get the first aid kit and AED if available. Help the person lie on his back. Cover the person with a blanket to keep him warm. Check to see if CPR is needed. If so, provide CPR.
And we're on Zoom.
All right, let's hustle out there.
Have you ever had a nosebleed? Maybe from blowing your nose too hard? Or how about from getting hit in the nose with a ball?
Okay, you're going in next. I want to see what you can do.
Coach, sorry, Coach.
Hey, Bobby tipped it and the ball just came your way. Need some help?
Yeah, I need some help.
Hey, Angelo, go get the first aid kit from the gym office. No, lean your head forward.
I thought I was supposed to hold my head back.
No, you don't want to lean your head back when you're trying to stop a nosebleed. Okay. I'm going to pinch your nose pretty hard with this gauze. Maybe for several minutes.
Okay, I'm ready.
To stop a nosebleed, apply pressure and follow these first aid steps. As with other bleeding emergencies, first make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Have the person sit and lean forward. Pinch the soft part of the nose on both sides with a clean dressing. Place constant pressure on the nostrils for a few minutes until the bleeding stops. If bleeding continues, press harder. Phone 911 if you can't stop the bleeding in about 15 minutes, if the bleeding is heavy, such as gushing blood, or if the injured person has trouble breathing. Sometimes, when a person suffers a mouth injury, one or more teeth may have broken, become loose, or been knocked out. This can be a choking hazard. As with other emergencies we've discussed, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Then, follow these first aid actions that are specific to tooth injuries. Check the person's mouth for any missing or loose teeth or parts of teeth. If a tooth is chipped, gently clean the injured area and call a dentist. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. If a tooth has come out, it may be possible for a dentist to reattach the tooth. So when you hold it by the crown, the top part of the tooth, not the root. Apply pressure with gauze to stop any bleeding in the empty tooth socket. Clean the area where the tooth was located with saline or clean water. Put the tooth in one of the following: egg white, coconut water, or whole milk. If none of these is available, store the tooth in the injured person's saliva, not in the mouth. Immediately take the injured person and tooth to a dentist or emergency department. Eye injuries are fairly common when it comes to providing first aid. Any direct hit, such as a punch to the eye or chemical in the eye, can create big problems. If the eye is hit hard or punctured, phone 911 and tell the person to keep both eyes closed. If something small like sand gets in a person's eye, rinse with lots of running water. Phone 911 if the sand or object doesn't come out, if the person complains about extreme pain, or if the person still has trouble seeing. Tell the person to keep his eyes closed until someone with more advanced training takes over. If chemicals get in a person's eyes, also rinse with lots of water. Rinse for at least 15 minutes or until advanced medical care arrives. If an eye wash station is nearby or you have access to an eye wash kit, use it. If neither is available, use water from the tap or normal saline or contact lens solution and phone 911. If only one eye is affected, make sure the eye with the chemicals in it is the lower eye as you rinse. Try not to rinse the chemicals into the unaffected eye.
Which trail you boys want to take?
How about the one we did last time? It has some great jumps. Yeah, and let's see who can go 3 times around the fastest.
Now, guys, this isn't a race. Hey! Wait up!
A concussion is one type of head injury. Concussions usually happen because of falls, motor vehicle accidents, and sports injuries. A concussion may occur when the head or the body is hit so hard that the brain is moved inside the skull.
Sam! Boys, stay back. Sam, you okay?
Oh, my head. My head. Oh, I'm dizzy.
Oh, gosh, you hit your head really hard, man. I don't know what to do. I'm gonna call 911, all right?
The possible signs of concussion are feeling stunned or dazed, headache, nausea or vomiting, dizziness, unsteadiness, difficulty in balance, double vision or flashing lights, confusion, and loss of memory of events that happened before or after the injury. With any kind of head, neck, or spine injury, be cautious about moving an injured person. Suspect a head injury if the person fell from a height, was injured by a strong blow to the head, was injured while driving, was in a car crash, or was riding a bicycle or motorbike that was in a crash, especially when not wearing a helmet or the helmet broke in the crash. In addition, a person with a head injury other than a concussion may not respond or only moan, vomit, have trouble seeing, walking, or moving any part of the body, or have a seizure.
Yes, he's conscious. Yes.
If a person has a head injury that results in a change in consciousness, worsening signs or symptoms, or other cause for concern, the person should be evaluated by healthcare provider or EMS personnel as soon as possible. And phone 911 if the person loses consciousness. A person with these signs should not play sports, drive a car, ride a bike, or work with heavy machinery until a healthcare provider says it's okay to do so. If a person falls, he or she may have injured the spine, which protects the spinal cord. Suspect possible spinal damage if the person is 65 years of age or older, was in a car or bicycle crash, has fallen, has tingling or is weak in the extremities, has pain or tenderness in the neck or back, appears intoxicated or not fully alert, or has other painful injuries, especially of the head or neck. When a person has a spine injury, do not twist or turn the head or neck unless it's necessary to turn the person face up to provide CPR, or you need to move the person out of danger, or if the person is having trouble breathing, is vomiting, or has fluids in their mouth. To summarize, follow these steps when giving first aid for a possible head, neck, or spine injury. First, Make sure the scene is safe. Phone 911 and get a first aid kit and AED. Have the person remain as still as possible and wait for someone with more advanced training to arrive.
All right, you guys, bring it on in. Let's finish up some stretching and then we'll start off with something basic, maybe some round offs.
Oh, Coach.
What happened?
I was trying a tumbling pass and I hadn't warmed up and I just landed funny.
Well, can I take a look at it?
Yeah.
Okay, where does it hurt?
Right here.
All right, you may have sprained your ankle. Sophie, go get the first aid kit. It's in the break room, okay? And Ann, go and get a bag of ice, put a little bit of water in it, grab a towel, okay? It's in the break room too.
Injuries to bones, joints, and muscles are common. But without an x-ray, it may be impossible to tell whether or not a bone is broken or the injury is a sprain. Either way, you'll take the same first aid actions.
All right, here you go. Careful. All right, now this is probably going to be a little cold, okay?
Okay.
How does that feel?
It's okay. Coach,
yeah?
What am I going to do?
Well, you're probably going to have to stay off of it for a little while.
This couldn't happen at a worse time.
I know. Well, this will help with the pain and swelling, okay? Keep this on for 20 minutes, then take it off. No walking on it, definitely no tumbling until you get this checked out.
Okay.
First, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Cover any open wound with a clean dressing. Put a towel on top of the injured body part and place a bag filled with ice and water on top of the towel over the injured area. Keep the ice in place for up to 20 minutes. Phone 911 if there is a large open wound, the injured body part is abnormally bent, or you're not sure what to do. If it hurts, the person should avoid using the injured body part until checked by a healthcare provider. Burns are injuries that can be caused by contact with heat, electricity, or chemicals. Specifically, heat burns are caused when a person comes in contact with a hot surface, hot liquids, steam, or fire.
Mommy, can I have some of that?
What, my powder? Here you go.
And that, can I have some eyeshadow?
Yes, but that's it. I have to finish getting ready. There you go. Here, Dana, let me put that back.
Mommy, you burned yourself!
Oh, let me run some cool water on it.
The only thing you should put on a burn is cool water and clean dressings, and never use ice. It can actually damage a burned area. Follow any further instructions by a healthcare provider. Take these first aid steps if the burn area is small. First, make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Cool the burn area immediately with cold but not ice cold water for at least 10 minutes. If you do not have cold water, use a cool or cold but not freezing clean compress. Run cold water on the burn until it doesn't hurt. You may cover the burn with a dry, non-stick, sterile, or clean dressing. If there is a fire, the burn area is large, or you're not sure what to do, phone 911. If the person or his clothing is on fire, put the fire out. Have that person stop, drop, and roll. Then cover the person with a wet blanket. Once the fire is out, remove the wet blanket and carefully remove jewelry and clothing that is not stuck to the skin. For large burns, cool the burn area immediately with cold water for at least 10 minutes. After you cool the burns, cover them with dry, non-stick, sterile, or clean dressings. Cover the person with a dry blanket. Check for signs of shock. A person with a large burn should be seen by a healthcare provider as soon as possible. A healthcare provider can determine if additional treatment is necessary. Whether outdoors hiking or indoors around the house, we've all been bitten or stung at one time or another. The first aid actions for most bites and stings are similar. First, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Phone 911. Clean the bite with soap and water. Use dressings and pressure to stop the bleeding. Call a healthcare provider for all bites that break the skin. And put a bag of ice and water wrapped in a towel on the bite or sting for bruising or swelling. There are a few important differences depending on the type of bite. Let's take a look at some of those now. When an animal bite breaks the skin, the wound can bleed and become infected. With animal bites, be sure to wash the wound with plenty of soap and water. And for all bites that break the skin, call a healthcare provider as soon as possible. Apply a bag of ice and water wrapped in a towel to help with bruising and swelling. Rabies in wild animals is most frequently reported in raccoons, skunks, and bats. Dogs bitten by infected animals can become infected. Anyone who has had direct contact with a bat or has been alone in a room with a bat should contact a healthcare provider as soon as possible.
This is what you do. You trim them here and there. See?
I love going with you, Mommy, but I don't like all these bees.
You know, they are buzzing around here. You know what? Let's go over here. Let me show you these plants. Let's smell these roses. Look at these.
Oh, ow, are you okay, Mom?
Oh, gosh. Well, I guess I got stung. Let's go inside because I got to remove the stinger, okay? Let's go. Come on. Whew. Oh.
Bees are the only insects that leave behind their stingers. If you or someone you know gets stung by a bee, you should look for the stinger and remove it.
Take the stinger out, okay?
Scrape the stinger and venom sac away with something hard and dull that won't squeeze it, like the edge of a credit card or photo ID card.
Oh, that's what you just kind of flick it like that. Oh, there, I got it. I'm gonna wash it now, okay? You have to
wash the sting or bite area with running water and soap.
Okay, I'll put this in my purse real quick. Oh, let me grab ice. Oh, can you grab the towel for me, please?
Here you go.
Perfect, here you go. Put it on my arm. Okay.
Put a bag of ice and water wrapped in a towel over the area for up to 20 minutes. Watch the person for at least 30 minutes for signs of a severe allergic reaction, and be prepared to use his or her epinephrine pen. People who have had severe allergic reactions to an insect bite or sting usually have one and know how to use it, and they often wear medical identification jewelry. Phone or send someone to phone 911 and get the first aid kit if the person develops a severe allergic reaction, and use the skills you learned earlier in regards to using an epinephrine pen. Another insect to be aware of is ticks. They're found in wooded areas and attach themselves to exposed parts of the body. Many are harmless, but some carry serious diseases. If you find a tick, remove it as soon as possible. The longer the tick stays attached to a person, the greater the chance of catching a disease. Follow the same first aid actions as those we've just discussed. But the first aid actions for ticks also include removing them from the person's skin. Use tweezers to grab the tick by its mouth or head, as close to the skin as possible. Try to avoid pinching the tick. Lift the tick straight out. If you lift the tick until the person's skin tense and wait for several seconds, the tick may let go. Remember to wash the bite area with running water and soap. If you are in an area where you know there is tick-borne illness, Suggest that the person see a healthcare provider as soon as possible, and place the tick in a plastic bag to take with him. The hot sun can be fierce, especially when we work, train, or play in extreme heat. If a person doesn't take the proper care, exposure to extremely hot environments can lead to life-threatening medical conditions.
All right, guys, let's watch our pace and meet back here. 6 miles today, guys.
Got it. So what's with all the water?
It's gonna be hot out here. We gotta be prepared.
Have you had some water to drink? You need to be hydrated before you start.
Yeah, earlier. All right, come on, you guys, let's go.
Hey, we've been going for a while. Let's take a water break.
No, this is great. I can do it. Just a little more and then we'll stop.
Dehydration occurs when a person loses water or fluids through heat exposure, too much exercise, vomiting, diarrhea, fever, or decreased fluid intake. If not responded to early, dehydration may lead to shock. Signs of heat-related or environmental dehydration include weakness, thirst, dry mouth, dizziness, confusion, or less urination than usual. If you suspect a person is dehydrated, contact a healthcare provider right away. The best first aid for dehydration is prevention. Make sure a person drinks and eats enough to stay hydrated.
Hey man, let's stop. Look, I know you want to make this long run today, but you do not look so well.
No. Isn't that what running's about? Pushing yourself?
Hey, man, you're not looking too well at all. Hey, guys, come quick.
I'm okay.
Whoa. Walker.
Beverly, phone 911, and you go to the park office, get a first aid kit and an AED. Walker, can you hear me?
My head.
We need to get cold water on him quick.
All right, our car, it's close. If we get him there, we can use the drinks in the back. Will that work?
Yeah, let's do it. Okay.
Yes, we're at the parking lot on the south side of Riverside Park.
Walker's doing.
He was doing a 6-mile run with us when he collapsed. Marcus, what was he like before he collapsed?
Heat cramps, really tired. I could tell he was overdoing it, but he wouldn't stop.
He said heat cramps, really tired, overdoing it. We're trying to get him some water now.
Bring your head forward.
Walker, talk to us. You okay? You all right?
I know better. I should have drank more.
Beverly, get one of the sports drinks out of the ice chest.
Okay.
You think you can drink some? All right,
good. The signs of heat exhaustion are nausea, dizziness, vomiting, muscle cramps, feeling faint or fatigued, or heavy sweating. Take these first aid actions for heat exhaustion. Make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Phone 911. Have the person lie down in a cool place. Remove as much of the person's clothing as possible. Cool the person with a cool water spray. If a cool water spray is not available, place cool, damp cloths on the neck, armpits, and groin. As with heat cramps, if the person is responsive and can drink, have the person drink something with sugar and electrolytes, such as a sports drink or juice, or water if these aren't available. From extreme heat to extreme cold, frostbite typically occurs outside in cold weather, but but it can also occur inside or in a workplace if people are exposed to extremely cold materials, such as cold gases, without wearing gloves. Frostbite affects parts of the body that are exposed to the cold, such as the fingers, toes, nose, and ears. Here are the signs of frostbite. The skin over the frostbitten area is white, waxy, or grayish yellow. The frostbitten area is cold and numb. The frostbitten area is hard, and the skin doesn't move when you push it. When giving first aid for frostbite, make sure the scene is safe. Then move the person to a warm place. Phone 911 and get the first aid kit. Remove wet or tight clothing and pat the body dry. Put dry clothes on and cover with a blanket. Remove tight rings or any bracelets from the frostbitten part. There are some things you should not do for frostbite. Do not try to thaw the frozen part if you think there may be a chance of the body refreezing before you can get to medical care. If you need to touch the frostbitten area, do so gently. Rubbing it may cause damage. Staying too long in a cold, pouring rain or other wet and cold conditions can lead to hypothermia. Hypothermia is another name for low body temperature. When this occurs, it can cause serious problems or even death. A person can develop low body temperature even when the outside temperature is above freezing. The signs of low body temperature may include skin that's cool to the touch, shivering, which stops when the body temperature is very low, confusion, and a change in personality. The person may also feel sleepy or seem unconcerned about his or her condition, or the muscles may become stiff and rigid while the skin becomes ice cold and blue. As the person's body temperature continues to drop, it may be hard to tell if the person is breathing. The person may become unresponsive and even appear to be dead. Here are the first aid actions for a person with low body temperature. First, make sure the scene is safe. Get the person out of the cold. Remove wet clothing, pat the person dry, and cover with a blanket. Phone 911 and get the first aid kit and AED. Put dry clothes on the person and cover the body and head, but not the face, with blankets, towels, or even newspapers. Remain with the person until someone with more advanced training arrives. If the person becomes unresponsive, check to see if he or she needs CPR. Provide CPR if needed. It's important to get the person to medical care as soon as possible. A poison is anything that someone swallows or breathes or that gets into the eyes or on the skin that causes sickness or death. Many products can poison people. Here are general first aid actions to help someone who has been exposed to a poison. First, make sure the scene is safe. However, making sure the scene is safe takes a few more steps when you think a person has been exposed to a poison. Look for spilled or leaking containers. If the scene seems unsafe, do not approach. Tell everyone to move away. Stay out of the scene if you see multiple people who may have been poisoned. Get the first aid kit and AED. Phone 911. Tell the dispatcher the name of the poison if you know it. Some dispatchers may connect you to a poison control center. Give only those antidotes that the Poison Control Center or dispatcher tells you to. The first aid instructions on the poison itself can be helpful, but may be incomplete. Some places have a safety data sheet, or SDS, that provides a description of how a specific chemical or poison can be harmful. It may have first aid recommendations as well. The phone number for the Poison Control Center should be in the first aid kit or prominently displayed in the areas chemicals are used. Contact your local poison center by calling the American Association of Poison Control Centers at 1-800-222-1222. When you call the Poison Control Center, they may ask for the following information. What is the name of the poison? Can you describe it if you can't name it? How much poison did the person touch, breathe, or swallow? How old is the person? What does the person weigh? When did the poisoning happen? How is the person feeling or acting now? If you approach the scene, wear personal protective equipment. Move the person from the scene of the poison if you can, and help the person move to an area with fresh air. As quickly and as safely as you can, wash or remove the poison from the person's skin and clothing. Help the person to a faucet, safety shower, or eye wash station. Remove clothing and jewelry from any part touched by the poison. Use a gloved hand to brush off any dry powder or solid substance from the person's skin. Run lots of water over the affected area until advanced medical care arrives. If an eye is affected, ask the person to blink as much as possible while rinsing the eyes. If only one eye is affected, make sure the eye with a poison in it is the lower eye so that you don't rinse the poison into the unaffected eye. Provide CPR if the person becomes unresponsive and isn't breathing normally or is only gasping. Use a mask for providing breaths. This is especially important if the poison has contaminated the person's lips or mouth.
Hello, everybody. Thank you for participating today. I believe I documented most of your participation. I did not see the following people. If you could just email me if you were on here, because like we said earlier, a couple of you are under NC 16101 or so-and-so's phone, and I couldn't identify you. So the only people that I believe we are missing are Billy Lastoria, Patty McConnell, Colleen Rhodes, Marquita Rice, and I believe that's it. So you may be on here. Please just email me when you do get a second. I'm going to let the nurses leave. Anything else that you want to share? I have a few other things I got to tell the paraprofessionals. And
Yeah, just really quick, remember to stop in to your school nurse's office tomorrow so that we can finalize this. So you just watched the video today, but there is a little demo part. We would just want a couple of things we just want to make sure you guys are able to share so we can mark the office passed, okay? See you guys tomorrow.
And one more, couple quick announcements. The first comes from George Washington, Dave Antuano. If you do participate in the distribution, you're going to come up to Croton and help again tomorrow. You can't wear shorts. We understand it's going to be warm and you're going to be moving around a little bit. Next, junior, senior high device distribution. We are looking for volunteers to help at the junior, senior high. So if you're a paraprofessional, 6th grade, junior, senior high, if you want to participate, you can also wear shorts tomorrow. It's going to be hot out, and we need as many hands as we can get. I am having a training at 10:30 for the special ed staff. If you can participate, great. If not, if you have to do one of these other duties, I'm fine with that as well. Everybody's just working together to get done what we need to. I will record it just like we recorded this, and we'll send out a link. So have a good night, everybody. Thanks for participation, and I will talk to you soon. Bye. We got to do now stop share. We did that, leave and end meeting.
They get all their devices back on.